Okay, well, everybody, thank you so much for coming. So tonight we have Jesse Billingham to speak with us about the Roux Institute Preclinical Gap Year Program. And I think that hopefully we have folks from Bates, Bowdoin, and Colby. So I think, Jesse, if it's okay with you, I'll turn it over to you, and then hopefully at the end we'll have a little bit of time for questions. And yeah, so thank you so much for being here.
Yeah, absolutely. Thanks for having me. Hey, everyone. My name is Jesse Billingham. I'm a program manager at the Roux Institute here in Portland, Maine. And if you're unfamiliar with the Roux Institute, it's one of the campuses of Northeastern University. It opened up right in kind of the middle of the pandemic in 2020. And academically, it's really focused on graduate level work. But outside of that, it's really focused on entrepreneurship and workforce development and research and things like that. And it's sort of in the workforce development vertical that the program that I'm here to talk to you about today sort of sits. So I've just got a couple slides to share. So I'm just going to share my screen real quick. Is that showing up? Is there a post-degree gap year program thing showing? All right, awesome. So the program that I'm here to talk to you about tonight is our healthcare gap year program that's based out of the Roux Institute, as I mentioned. And what we have received is 2 years worth of funding to run a pilot program that's healthcare focused here in the state of Maine with two main goals. The first goal of which is to provide aspiring healthcare providers, such as yourselves, real world on the job training in healthcare in an entry level clinical patient-facing role, while at the same time assist our network of healthcare partners with filling these critical vacancies in these entry-level roles throughout the state at their clinics and their hospitals. Our program itself is a little bit different than other gap year programs that are healthcare focused in the sense that we don't require any additional credit hours or additional coursework for the program. The job is really the main focus here. We're really interested in getting folks connected to our network of healthcare partners and finding them roles that are going to meet their needs and interests and get them to the next step, whether that be applying to medical school, getting clinical hours to apply to PA school, whatever that might be. Our program here, as I mentioned, we have a network of healthcare partners in the state. That list is actually a little bit outdated. We have a few more than just the icons that you see on your screen right now. If you are at Bates, we have partnered with Covenant Health, which has St. Mary's Hospital right there in Lewiston. And if you are at Colby, we partnered as well with Health Reach, which is a federally qualified healthcare center. They have their headquarters right there in Waterville and 12 clinics that are sort of spread throughout the greater Waterville area and heading west all the way over to Bethel. So a couple additional partners there that are not on the screen, but are on our website. Let's see. Switch slide. Come on. So to kind of dive into the meat of the program, the first piece of value that our program brings for folks is the connection to the employer. So what we heard from a lot of individuals graduating is that they were applying to a lot of healthcare institutions in these entry-level roles, but they weren't getting much in the way of response from the employer because they didn't have much in the way of clinical experience going in. So the program that we have developed allows folks to come in with very limited, if any, clinical experience or patient care experience, which is one of the really great things and value added, I think, for folks in the program itself. So what we do is we facilitate that connection with the employers to kind of smooth that over and to get you right in front of a potential employer that you might be interested in working for. We do ask that you make a 12-month commitment with the employer in question. And that role that you take is just like any role or any job that you might have with any healthcare partner or any employer out there. So it's going to come with an hourly rate or salary and benefits that are associated with full-time employment with that employer, everything ranging from paid time off to healthcare, everything is just sort of typically comes with that. That all comes from the employer side. Then on the Roux Institute side, sort of the next phase of benefits and support that we're able to provide beyond just that employment connection piece is the biggest carrot of which is a $500 a month housing stipend for 12 months for full-time employment. That's something that we're really excited to be able to provide and that we're hearing really positive feedback, as you can imagine, from our current cohort who said that that's really made the difference when accepting these roles to come up here in Maine. So we're really happy to be able to provide that piece of it. The additional support that the Roux is able to provide as well kind of falls in one of two buckets. The first bucket of which is exposure to things that are happening in the state of Maine. So we recognize that not everything that you might be interested in is going to be available at your place of employment, even though that is sort of the primary focus. So we want to make things available to you outside of work. This includes events that are happening at our partner organizations, whether that's a career panel about different healthcare roles that are out there that you might be interested in. We offered up a Healthcare Start Summit with partnership with UNE last year to folks. That's sort of like a hackathon where people from different backgrounds come together and they work on a healthcare or public health related issue. We offered a wilderness first aid training program, which was a 2-day course for all of our participants, which was super popular last year. So it's a variety of different things like that over the course of 12 months that we just want to make people aware of, make it available to folks that they can sort of participate in outside of their employment piece. It tends to be a little bit of an a la carte menu. Some of our participants are really excited to take part in as much as they possibly can outside of work over their 12 months, while others are like, you know what, I'm working a ton on the job. I'm also studying for the MCATs. It's all I can handle. Both of those choices are perfectly valid with this program. We want to be able to provide additional options for folks, but we do not require them. Bucket number 2 of support tends to be a little bit more of like an open door policy. So we recognize, again, that folks aren't going to get everything that they need out of that place of employment. And so we want to have an open door policy where if you need something else, come to us and we'll do our best to address that. Some examples from our current cohort include setting folks up with advising services if their undergraduate institution doesn't continue to provide that for them, assisting some of our participants with international citizenship with workforce authorization support, assisting some folks with finding a mentor or someone to shadow if the healthcare level that they're interested in or role that they're interested in isn't represented at the clinic or hospital that they're working at. So it can be a variety of things. We just ask, come to us and we're going to do our best to find a solution or an answer for you over the course of the 12 months. I mentioned our network of healthcare partners. We are up to 10 now, which we're really excited about. And I alluded to this a moment ago, but 2 unique aspects of our healthcare partner network is that they understand that participants coming through our program don't have a lot of clinical experience already, and they're really excited about finding roles for you where you can get that on-the-job training piece. The other thing that's expected is that they recognize that start dates are going to be a little bit delayed due to folks graduating. Most folks in our program are coming right out of undergrad. So in our current cohort, everyone began during the May to August timeframe of this past year, and we're looking at the May to August timeframe for folks to start employment in 2024 as well. So there's a nice little break there and pause between when you graduate and when you'd need to begin work again here in the state of Maine. Just to kind of highlight some of the employment opportunities that are with our partners. You can see the medical assistant, emergency department technician, phlebotomist, dental assistant, patient services rep. This is by no means an exhaustive list of opportunities that are out there. These are just some of the ones that our current cohort have decided to find themselves in. There's a wide range of opportunities at all of our healthcare partners. I mean, we work with everything from Maine Health, which is the largest provider in the state, all the way down to the Oasis Free Clinic, which is in Brunswick. So really small providers as well, all of which are really excited to work with our participants and to find great roles for them. You'll notice a little bit about networking and some additional options here for the benefits that are provided by the Roux Institute. While you don't end up being a matriculated student with Northeastern through our program, we do open up the Institute itself to you to use. So the space itself, you're welcome to come to study out of it, just use it however you like. So we try and welcome you into that environment and also connect you with additional experiential learning programs that are happening out of the Institute, including our co-op folks and our summer internship folks as well. So to kind of run through just the process itself, it typically starts out with an information phone call and submitting an interest form to the Roux Institute via the website. And I'll put the link to that website in the chat here momentarily. Once we have an initial conversation, we work to identify a few of our healthcare partners that you're most interested in being connected with. And then once that happens, we handle that facilitation piece on our end and connect you directly to those folks to start a conversation. And it's through those conversations with the employer partners where you work to identify a role with them that you are interested in applying to, and they help you with that process as well. You go through the process of formally applying to a job just like you would anywhere else. And then if an offer is made and you accept that offer, that's when your commitment to the program actually begins. So there's no commitment up until that point where you actually are accepting a job offer with one of our partners. And if you do accept an offer, then you can become eligible to become formally enrolled in our program and eligible for all those additional benefits, including the housing stipend that we talked about. And all of those additional support pieces are good for 12 months. With us. However, there is no upper limit to the employment piece. We have some participants right now who are going to be approaching the end of their first year, their gap year, of which we're currently supporting. But after that 12 months, they're going to continue to work with our healthcare partner because they're having a really great experience, which is a wonderful thing. If that is something that's decided between a participant and a healthcare partner, then we're all for it. The additional sort of financial support from the Roux Institute would end after 12 months, but there is no upper bound, as I mentioned, to actually working with one of our healthcare partners. Just to kind of quickly go through some important pieces of information to highlight, there is no cost to participants to be in this program. There's no additional coursework or credit hours required. There is no requirement for trainings or certifications coming into the program. All of that is received on the job through our healthcare partners. You're hired into existing roles that are, you act just like regular employees with all the wages and the benefits that come with that. Start dates, again, wouldn't be until after graduation. We like folks to be onboarded between May and August. One thing that is really important to note as well is that participants are expected to find their own housing. While we were excited to provide the housing stipend, and we do assist in the search, particularly in the greater Portland area, by providing a list of landlords and connecting all participants together. The search itself is a responsibility of our participants. And then one other thing to note, this is a pilot program. We were hoping to get 20 folks in our current cohort. We exceeded that and have 23. And we were hoping for 20 in year 2, but I think we've moved some things around and we're hoping to be able to support as many as 30 individuals for this year 2, starting in between May and August. So we're really excited to be able to increase that amount for this upcoming year. And with that, that's sort of a high-level overview of the program that we have. I'll toss this link that you see on the slide into the chat in just a moment, as well as my email address. But I'll pause here and see if there's any questions coming to the surface.
Could you talk a little bit more about like what the process is to figure out who gets assigned to what job or what program, I guess?
Yeah, absolutely. It's a great question. So after you submit an interest form, we will set up a call where, well, first I'll ask for an updated resume from you just to get some information from you. And then we'll set up a call where we'll spend some time going through a little bit more meticulously each of our 10 healthcare partners. We're going to talk about where they are geographically in the state, what types of roles our current cohort are finding themselves in, and what additional opportunities that they have. And through that conversation, we'll hopefully identify anywhere between 2 and 4 of our partners that you're specifically interested in being connected with. And then I will facilitate that connection. And those first conversations, once those partners reach out to you, is a really great opportunity for you to kind of express your interest in the things that you want to get out of a gap year, because those contacts at each of those partners are going to use that information to guide you towards roles that would be a great fit for you, that you could get good on the job training for. So it's an initial connection that we make with the partner, and then a continued conversation that you have directly with them to identify what roles those are. So you have a lot of control over that piece of the process.
Thank you.
Yeah.
So Jesse, you said that this is a pilot program and you're in the midst of year 1. What are you hearing from folks so far?
Yeah, we're hearing some really great feedback about, let's see, in December now, about a couple months ago, we did sort of a 6-month check-in with our current cohort of 23 to see where they're at and how things are going. And everyone's having a real great experience across the board. Our current cohort are with 5 of our different partners: Maine Health, Northern Light Health, the Vane Healthcare Center in South Portland, Greater Portland Health, and then the Knox Free Clinic up in Rockland is where they're scattered about right now. And a couple of things that they really enjoyed about the program are, one, the connection to the employer up front. That was really helpful for a lot of folks. And a lot of folks really appreciate the fact that there aren't a lot of additional commitments in the program outside of learning on the job and getting that real world experience. They appreciated that there were additional opportunities out there that they could pick and choose from, but it wasn't a requirement. And then, of course, everyone was really excited about the $500 a month housing stipend. And some of the direct feedback we got about that was that it made the difference between choosing a program in the Boston area versus coming up to Maine, which we like to hear. And that it made it comfortable and doable was sort of the word folks use. Because, I mean, ultimately, these are still entry-level jobs. They're not going to be paying the highest, hourly rates, but this additional $500 a month, goes a long way. And another note on that is we call it a housing stipend because we recognize that that's one of the biggest challenges folks are facing, but we don't require that. That is a $500 a month payment directly to the individual, not to a landlord or a rental agency or anything like that. So that is money that goes to our participants that they are actually free to use however they see fit.
That's wonderful. Yeah, I know that we have a Bowdoin graduate who's in the program this year, and one of the things that I heard as well that was a differentiator was what you were saying in terms of the on-the-job training. So getting to go into a position like a medical assistant, it's not really something that you're qualified to do without additional certification in an area like Boston. But, because it's a part of this expectation, and because, there's great need in the state of Maine, it's something that can be a part of this experience, which was pretty exciting.
Yeah, absolutely. And just to kind of like highlight a little bit more about what you just said, there's a non-licensed medical assistant role here that many of our partners are hiring folks into. And just as you said, it does not require someone to have that license ahead of time. They can come in and work under that heading of medical assistant, perform about 95% of the tasks as a licensed medical assistant, and learn those skills along the way as they build up that experience, with the idea being at the end of 12 months, if folks want to, they will have gained enough knowledge and experience to actually sit for a licensure exam within the state of Maine if they so choose. It wouldn't be a requirement, but it's a nice pathway to get there. And you can contrast that with some other roles that we're finding folks in, like phlebotomy with Maine Health, where the first, I'd say, I think it's 4 or 6 weeks of folks' employment is actually going to their like certification training course. And you come right out of there as a certified phlebotomist and you kind of hit the ground running. So there's a variety of different pathways that our partners are taking when it comes to training folks and getting them, into those roles.
Hi, my name is Hoining, and I work at the Bates Center for Purposeful Work at Bates College. And I just want to say thank you for the inclusion. Really appreciate our Bowdoin colleagues. I had a question in terms of, you mentioned that this program is a pilot. So as you're thinking forward, what are you going to be metrics of success for you in terms of thinking about, what to do next and how to expand the program and its opportunities?
Yeah, absolutely. So it's absolutely something that we're thinking about right now. We started our current cohort off with an entry survey, asking a whole bunch of questions about what their background was, what their goals were for their gap year, what their perception of different healthcare roles are, where they saw themselves going after their gap year. So we tried to get as much kind of data, like baseline data about folks and how they're entering, this year. And then we also tried to get as much data as we could from our healthcare partners about how they're thinking about the program, how they're sort of structuring things and the communication with our participants. And so after our first year is done, we'll be following up on both ends there with exit surveys, essentially, to see from our participants how this impacted their ability to move on to the next phase of their career, whether that be graduate school in a health program or continued employment somewhere. Asking our healthcare partners about what types of things they're seeing with the participants. Are there people staying with them to work? Are there different ways that we can support our partners to help them work with our participants and structure those trainings and things like that? So we're looking to get a lot of good feedback on either end there. But the idea that we can both broaden the partner network and work to support more individuals over time. So right now, this pilot phase, we're having this conversation right now about year 2 participation, and we'll be able to fully support a second cohort that'll be through probably September 2025 when folks are finally finishing up. And we're in conversations right now with potential funders to look at supporting this for a year 3 and beyond.
So I had another question if no one else is piping up just yet. So yeah, are you finding that a lot of the participants are, kind of falling into one category in terms of, people who are just wanting to take one gap year before going to medical school, or, that they're largely, preparing for like a PA or an NP program, or is it kind of distributed across at this point?
Yeah. So our first cohort, we saw the vast majority of folks were from Maine originally, and most of them were really interested in becoming an MD or a DO level, and using this gap year to gain clinical experience to bolster their applications to medical school, and while maybe studying for the MCATs on the early side of it as well. As recruitment is going on for this year 2, we're seeing a bit of a shift, which is great because the word is getting out more and sort of the net is being cast wider, so to speak. And so far, that percentage of at least interested individuals to date has dropped to 38% for Maine. So an increase in out-of-state interest, which is really great. And we're seeing a broader sort of range of what folks' interest levels are. So there's certainly still like a strong group of individuals who sort of know their path, are like, I'm going to med school, I'm going to PA school, I'm using this gap year to get, patient care hours to support those applications. But we're also seeing sort of a larger group forming, not the majority, but a group that's getting larger, where they are really interested in healthcare, but they don't yet know what provider level they're interested in. It's always been something that is of interest to them, but there's been barriers to just going back to school and paying those fees, or the costs of higher education and everything. So this is a great opportunity for them to take a year and explore what patient care really means, to learn about all the additional roles that are out there besides just MD, DO, or NPPA. And that's great. That's a really great use, I think, of our program specifically. And those folks are, overall ranging between, looking to take 1 year or possibly more than 1 year to explore that space further. So yeah, it's a widening range, I'd say, of levels where people are entering it from.
That's exciting.
Yeah.
It's nice to see like kind of a cohort that can learn from each other and yeah, really give a lot of different perspectives. I know that, there can be times when students I'm working with say, I really am just interested in 1 year, but I want to do clinical work.
Mhm.
And that can be a real challenge in a lot of places that are requiring a 2-year commitment to start out with. And so they might end up going a little bit more of the research route, even though that's not necessarily what they wanted to do. I'm also like amazed to see kind of there's maybe a little bit of a flexibility in terms of the start date too. I think that, in terms of it being somewhere between May and August,
Mhm.
I know that if it's going to be a 12-month commitment and someone is going to go to medical school the next year, oftentimes that starts in July. And so, you can get going and have a really valuable experience before then. So that's great.
Yeah, absolutely. That's one nice thing about the network of partners that we've sort of cultivated, is their understanding of the folks that we're sort of recruiting on their behalf, so to speak, in that they're open and willing to make a job offer in March to someone who isn't going to start until June, which is really great.
That's awesome.
So other questions?
Can I ask one more question?
Yeah, please.
How many of the current cohort are choosing to continue to stay on? Because I think that would definitely be something I would be interested in.
Yeah, right now I've talked to 2 who are talking about staying on, but our first folks who are completing their year that'll be in like June. So we still have a couple months
Okay,
before
yeah.
folks are making those decisions for sure. But yeah, there's definitely interest in that.
Okay.
Yeah.
And to build on Julia's question really quickly, and I'm sorry if I missed this from earlier, if someone chooses to stay on, do they continue to get the housing stipend? And at what point will that be cut off if it gets cut off?
Yeah, for sure. So we have 12 months of funding to support folks. So let's say, for instance, someone starts the program on June 1st, then they would have financial support through us until May 31st of the following year. So that's 12 full months of support. If you start on June 15th, that first month gets prorated and the last month gets prorated, but it's still a full 12 months. So it doesn't matter when you start, it's your day number 1 of employment, of full-time employment, is when that 12-month clock begins. If for whatever reason, 6 months into the program, you had to drop down and, take a leave of absence for some, issue that's going on in your life, we could hit pause on that housing stipend, and you wouldn't lose a month of eligibility. You still have full, that full 12 months. You don't lose that. At the end of the year, the end of the full 12 months, that housing stipend eligibility does end, just based on our financial means through the program. But we're talking about additional support not ending. So continuing to keep folks informed about, everything else that we're informing the current cohort about, and keeping folks together and connected that way, because we don't need financial resources to do that. And it's nice to sort of grow the group overall. So we haven't got there yet because we haven't gotten to the end of year 1, but we're in talks about how to kind of structure that and keep folks informed if they want to stay informed about, the trainings and other things that are happening here in the state of Maine.
So the $500 though does really help students or young alumni get settled into that first year before they have to kind of figure out the logistics kind of going after.
Yeah, absolutely. Yep. Yeah, it's
you.
a good cushion. It's a very good cushion. So in just to comment on the 2 things that I dropped in the chat, I dropped my email address, j.billingham@northeastern.edu. If you have any questions or are interested in the program, you're more than welcome to reach out to me directly. Another pathway is to click on the link there that I put in, and that's sort of our landing page for the program, which is going to talk about a lot of what I mentioned tonight, as well as some additional information. It has a full list of our healthcare partners as well, so you can explore their web pages and kind of see what they're all about. There's also an interest form there, which whether or not you fill that out first or you email me, it'd be great to get you to fill out if you are interested in the program. And that would be step 1 of the process in sort of continuing a conversation about this program.
Is there a deadline to fill that out, or it's just kind of on a rolling basis?
Yeah, great question. It is on a rolling basis right now. So we've been having conversations and connecting potential candidates with healthcare partners for a little over a month now, and we're starting to see job offers come in. So we've already had the first few acceptances, and I know one partner specifically just sent a whole bunch of offers this week. So roles are starting to be filled, spots are starting to be taken, and we'll continue to fill those roles until we get to around 30 folks. And if there's a lot of interest to go beyond that, then we'll look at the books a little bit, fine tune things, and see if we can find some funds to support additional folks. But right now we're looking at the 30-person range. So I would say if you're interested, there isn't like an immediate rush to get it in tonight. But if you are, then the sooner the better that we can connect you with a healthcare partner to start that conversation.
I had another kind of random question.
Yeah.
So how do you decide on some of those supporting activities? Like the wilderness first aid training sounds amazing. Was that something that came out of a response from the participants who said, yeah, we would really benefit from this? Or is that something that you guys kind of originated?
Yeah, it's a bit of a mix. So when we first met with our current cohort, we asked, like, what are you guys interested in? Like, what can we do for you? And And some of the things that they said were, they're interested in rural health, which is great because that's one of the focuses of our program. We're really interested in just getting people aware of how healthcare systems operate in more rural environments, whether that be looking at the state of Maine in general as a rural state compared to Massachusetts, or Jackman versus Portland kind of thing. And also we thought we're just trying to think outside the box of other things that are available that we could do in-house. I have been an EMT for over almost 20 years now, just sort of as my other life. And I also teach wilderness medicine on a contract basis for a school of wilderness medicine over in New Hampshire. So I said to myself, well, this is something that we could offer them, and really tie in the idea of taking care of patients outside of the clinic environment that most folks are going to get the experience in. But what are the considerations? What are the things we need to think about when we are several hours from that definitive care? There's going to be some overlap, certainly with what folks are learning, on the job, but there's going to be an expansion of those considerations and ideas. So it was a nice sort of tie-in to rural health and more, austere environments and providing care, and also just a fun certificate to get if you're going to go and explore outside in Maine.
I love it. I feel like that would really appeal to all the populations of Bates, Bowdoin, and Colby for sure. Large outdoor club presence there too. So that's great.
Yeah, that's fantastic.
Any last questions out there before we say thank you to Jesse and let everybody tuck in for the night? Maybe the students aren't tucking in for the night. It's possible I betrayed my age a little. Okay, well, thank you so much, Jesse. I really appreciate your time. This was amazing. And I feel like I got a lot out of it. And I know that sharing this video is going to be really helpful for so many of my students and across our institutions. So I really appreciate your time.
Yeah, absolutely. Thank you very much for the opportunity, and reach out with any additional questions. I'm happy to have a conversation.